In this short video, I'll show you how savvy healthcare professionals are saving time and reducing risk, all while increasing reimbursement revenue. Today, I'd like to introduce you to a brilliantly simple system that will increase your revenues while saving you time and stress. This system can save you thousands upon thousands of dollars in billing consultation fees, and this system will also save you hundreds of hours in system setup and education time. Plus, you'll be able to spend more time with your clients and less time figuring out how to code and bill a patient visit. You don't need fancy software or server systems that cost in excess of $10,000 to set up, let alone service. In this presentation, I'll show you exactly why the UberBill system is saving practitioners time and reducing their risk of fraudulent billing. You'll have access to a system that will simplify your coding documentation and billing process. Finally, because seeing truly is believing, you'll see how to save hours and hours a week with a complete system for coding all the services you offer. It fits easily into your schedule, and you don't spend time answering questions about the treatments you provided. If you have a healthcare practice and your time with your patients is truly valuable to you, this is going to be a game changer for your practice. Finally, you will eliminate the need for hiring billing consultants. This can save you thousands of dollars and reduce your workload. Or, if you're a healthcare practitioner who just doesn't have the time to focus on coding and billing, but who also doesn't want to spend time worrying about billing fraud, we have your solution. It's really for anyone who's looking to streamline their practice. To understand how we're making practitioners' lives easier, you have to understand how our UberBill system works. The impact of the Health Insurance Portability and Accountability Act, or HIPAA, has proven to be a massive hurdle for many practices. There are now thousands of agents working for the federal government just looking for false claims. The cost of fines for false claims went from $5,500 to $10,781 as of August 1, 2016. Most false claims are for improper coding. Why worry when you can verify coding before you bill? In 2016, the Department of Justice recovered more than $4.7 billion in settlements and judgments from civil cases involving fraud and false claims under the False Claims Act, or FCA. This is the fourth year in a row that the department has exceeded $4.7 billion in recoveries. The total amount of money obtained from January 2009 to the end of 2015 is $26.4 billion. Don't add to this statistic. Practitioners who thought that having a cash practice avoided fraudulent claims need to think again. Why? Fraudulent billing is triggered by misuse of federal funds. This is now part of state health insurance exchanges. You can't stop your cash patients from filing claims to their insurers for your visits. If they are reimbursed for your services and you used the wrong codes on their bill, you're at risk for fraudulent billing. Don't eliminate the largest source of revenue for your practice, patients with health insurance, especially in an era when most patients have less money. Then the solution came, the UberBill system. All practitioners in private practice now have a way to feel confident in their coding documentation and billing process. They can sleep like a baby, knowing their services are coded correctly, and gain back the largest market share in the U.S. with the UberBill system. All it took was a great coding, payment, and policy resource, coupled with an easy-to-use super bill and expert advice on building it. Voila! Even if Obamacare is completely repealed, the risk of fraudulent billing is not going away, even if you don't file insurance claims. Something that has nothing to do with delivering quality healthcare services has changed, the cash-only business model. Your practice may have converted to a cash-only business to avoid liability. You were not alone. Many others did the same. Savvy practitioners using the UberBill system have a way to actually increase reimbursable services and reduce their risks of false claims. The masses simply do not understand how to mine the gold from health insurance companies. However, providers must first learn how to bill legally for their full scope of practice. The broader the scope of practice, the more codes that can legally be used to bill for services, the more services you can bill for. Guess what? More codes and services equals more dollars. If you take nothing else away from this video, we want you to see how true this statement is. You gain clients and revenue by getting into what some practitioners would view as impossible to bill care and capitalize on this market before your competitors. And by getting into this revenue stream that other practitioners like you gave up on, you'll be able to get in on this parabolic shift before the crowd. Are you going to start capitalizing on this untapped market, or will you stay scared and continue to lose more patients every year? That's why what I'm about to show you will help you take advantage of the largest client base in healthcare, patients looking for providers who accept insurance. Because we offer the resources to help you take back that market share and enter it with confidence, we created the system to lead cash practices back into accepting insurance with confidence. With each day you wait, you are reducing market share. Get in and take it back before your competitors. This unmatched system allows you to capitalize on HIPAA and insurance law, all because we found a consistent and legal way to code and bill for your unique skills. It turns out you don't need to invest big money to turn your patient visits into codes, unlike electronic or health record systems, EHR, EMR, $15,000 to $70,000 startup costs according to healthit.gov. Our system can help produce a steady stream of insurance-backed revenue so you can take advantage of the trillion-dollar U.S. healthcare market. Let me take a few moments to explain how our system works. It guides you to convey your full scope of practice to all insurers, walks you through selecting the billing codes you need, provides your practice with 3 super bills coded truthfully and to the highest specificity, a federal requirement, automatically maps your unique services to codes you have to use for billing, teaches you to code a patient visit in 3 minutes or less, helps match SOAP notes to billing. The first 10 spots that are filled for the UberBill system will receive a free review of practice policies and procedures, a $750 value. The UberBill system will pay for itself in no time by increasing the number of patients seeking your care. Even better, the UberBill system includes built-in annual access to the most comprehensive medical billing encyclopedia available. You won't have to work extra hours, lose sleep, or invest huge lump sums to avoid filing fraudulent claims. Do not miss out on this opportunity to make your life easier and make more money today. We just want to help you get a larger client base and the respect you deserve in your industry. It's a couple of clicks away on your computer or mobile device. And the UberBill system could pay for itself in the first month or less that you use it. Is this the right choice for you? Only you can decide. We want you to strike while the iron is hot, and right now the iron is very hot. That's why today we would like to invite you to take your first-year trial run with us. What is the cost of a system to properly code each patient visit? Normally, large healthcare professionals in the industry like this are paying a minimum of $15,000 to set up an EMR, MHR, and paying $3,000 to $9,000 a year to maintain their servers. Some are paying up to $70,000. Seriously. But you won't have to invest that much. If you register today, you'll only pay a flat annual fee of $1,497. Just click on the Add to Cart button on the page below this video to get started. We'll see you in the members area.